well, we had this incident in 2014. What's the chances of something happening again? I mean, lightning is not going to strike twice, right?
And we do get a boom boom.
Exactly.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to episode 425 of the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs, and joining me is Donna Grindle from Cardin. Good afternoon, Donna.
Hello, David.
So, good weekend. How did your Georgia dogs do?
Well, they haven't really had to play a tough game yet, so it's good. But when you've been fan of Georgia sports, regardless of pro or college, you realize that 28-3 could always be a sign that you're going to lose.
True that.
Had 28-3 in the fourth quarter, you can still lose and lose big. Yes.
Yeah. Well, today we're going to be talking about somebody else who lost big.
Yeah.
So, as sometimes happens, OCR calls us up and says, David, so do you need some fodder for the show today? And I'm like, absolutely, I do. And so they said, great, we're going to release an enforcement message just for you. And I'm like, thanks. Appreciate that. Can't tell you who my contact is over there, but let's just say it goes to the top.
Yeah. Yeah, boy, the whole thing's run based on what you need, David.
Exactly. So if there ever was some type of conspiracy theory, I'm the top of the chain. So in saying that, we did have one come out. A resolution agreement came out, a corrective action plan, and I would say it is a not so subtle message as you should pay attention to. That's going to be our thing for today.
It is one of those messages that it's like that explosion and you don't look. Yeah. It was your house that blew up.
Yeah. Sometimes we talk about left of boom, sometimes right of boom. Today is just boom.
This is all decisions that could, these decisions were right of boom decisions. So we have left of boom wasn't handled. Then we have right of boom, which turned out to be left of boom that wasn't handled. So now we're in a settlement because right of boom twice with no changes is not where you want to be.
Yeah, that's called a boom train.
Duck, 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 duck.
You might want to grab that, boomtrain.com. All right. So before we do that, I do want to say thank you for those who follow us, share us out, and donate. We appreciate all 20 million of you who listen every single week as we bring you the truth.
20 million people every week caring about HIPAA, privacy, and security. That would be awesome.
Look, my mom clicks on that link a lot.
She doesn't know why. David said it was important.
Just do it. You're retired. Click on this link all day. That's all I want you to do. Don't ask why.
It keeps your computer running better. That's it. There you go.
If you don't do it, you'll get hacked. So anyway, with that said, let's get to our HIPAA brief today.
We thanked everybody. We did all our stuff. I'm so lost. Yes, our HIPAA brief.
She's lost in her briefs.
All right. I got to the briefs. I was lost before I got here. Okay. Today's HIPAA brief. Is it possible to be both a covered entity and a BA at the same time?
Yes. All right. Now.
Moving along. So many people don't get that, but you can be both. You can be a covered entity offering your services that you're getting paid insurance payments from while providing services on behalf of another covered entity who's getting paid, and then they're paying you. Simultaneously.
It can happen. Yeah, people have a hard enough time with the BA chain.
Yeah. The tail, it never ends. As long as there's PHI, there's a tail.
Mm-hmm.
You know, no, we don't count. We're so far down. No, you could be the core to the problem that is like, we should stop calling it a tail and call it a fuse.
There you go. I like that.
You could be the one to light the fuse. As long as the fuse is connected to you, you're responsible for not lighting that fuse. There you go.
Yeah. I like it. We'll go with that.
Mm-hmm.
Yeah. So the important thing to remember is if you don't know, you probably need to ask somebody or do like the covered entity flow chart to figure it out or whatever. It just amazes me how many times I have conversations with people who say that we are a covered entity and you're not, or we're not a covered entity and you are, or you're not a business associate and you are, which happens a lot more.
Yeah.
So definitely need to know if HIPAA applies to you. It might change your day.
And it could apply to you in two ways simultaneously.
True that.
So just know that.
Yep. So typically we do the HIPAA Say What segment, but since this show today is going to be all about HIPAA saying what, we're just going to incorporate the whole thing right here.
HIPAA say what?
Yeah, no kidding. So
Yes, I said that when I read it.
Yep. So the resolution agreement comes out today, and in like fashion, Donna's like, "Did you read this? It's so juicy."
I wasn't treating it like the Kardashians done something now. Come on.
No, that's exactly what you do. She's like salivating when is it enforcement action?
Yeah, that's it. Then we might get the 20 million listeners. So
Yeah.
if it was that cool.
It absolutely is. So so let's talk about it. Tell us what happened.
What had happened was, well, I think everyone needs to pay attention because, you know, we spend enough time reading legal stuff and lawyer guidance and all of that stuff. You learn that you pay attention to the words they use, because the words they use are always more important than people realize. So that is a thing that when we point out some of these words, they're going to tell you it's clear legal language. You just have to understand what that really means. You know, and we could all have our opinions. We're all welcome to. But I'm gonna go with our opinion just because we've read these enough. We're sometimes wrong, but you know what I'm saying.
But nobody knows my opinion better than me.
And you know, we're right most of the time. You know, at least 80 to 90%, if not more. So here's what you need to know about this one. This is the new LA Care Health Plan Resolution Agreement and Corrective Action Plan. They almost always come together, that resolution agreement and corrective action plan. The reason that everybody's going to see this is it's a $1.3 million cash settlement. It's not a fine. It's not a fine. They are paying some money to make it go away so that no one says they're going to fine you. The fines would be way more.
Yeah.
So, boom! 1.3 million. That's good. We hadn't had one of those in a long time. So the bigger thing, though, is always not going to be the money. The money's a lot. That tells you how bad it is. The corrective action plan tells you how bad they know it is. They're agreeing to do it. Not only are they agreeing to pay the money, but they're also agreeing to this cap. So here's a funky timeline, because this gets to the left of boom. So they were left of boom until March 3rd, 2014. They were no longer left of boom, because March 3rd, 2014, there was a article published at that time that said on January 24, 2014, some LA Care covered members who logged into their payment portal were able to see other members' name, address, and member identification number. So these disclosures took place over 2 days, January 22nd to the 24th, 2014, and all we know is they're a result of a, quote, manual information processing error.
Mm. Yeah, somebody screwed up.
Somebody screwed up. It wasn't just, deep in the code. Somebody did something they weren't supposed to.
Yeah, well, isn't that interesting, though, an article was published?
Yes.
About that? I mean, how many times do we tell people there are more ways that you could get on OCR's radar than having a data breach or, well, I mean, in this case it was, but it wasn't, it was an indirect result of that. People can file complaints. You could end up in an article. Who knows?
It is not as out of the question as many people seem to think it is.
Yeah. Yeah. I mean, there's been a number of times when I've heard somebody say, I understand we have a data breach, but we're just going to treat it like it didn't ever happen. That might come back to get you.
Well, it seems that this came back to get them because so that happened March 2013 or 2014. Now, keep in mind that January 2013 is when we got the official omnibus final rule for implementation of high tech.
Mm-hmm.
How I'm able to remember that, I don't know. Probably won't remember it the next time we need to talk about it. However,
because that's not long after you met me.
Right? The complete, you still had a few little areas on business associate agreements and those things that you had until September 2014 to get everything in line. But for the most part, all of the data breach notifications, all of this other stuff has technically been in place since 2009.
Mm-hmm.
And then, there's all those as everything comes online. And then at the same time that we have all of that coming online, we also have the data breaches starting, the big ones starting 2015, 2016. So this kind of falls into that period of chaos where they're figuring out the workflow for doing these investigations. These investigations are coming at them in a flurry. So they opened a compliance review based on the article from 2014. It's not sure how it really, got to them.
Mm-hmm.
They just say the article was in the media then, so somebody could have sent it to them. Anybody could have. The bottom line, though, is they opened this January 13, 2016. They opened a review about the 2014 incident. That date is important because they didn't get notified about that data breach until May 19th, 2016. So OCR already looked into the details. It was out there. And then they looked into the fact that they never got notified about it.
Yeah. Like you had 2 years.
Yeah, so they're already asking questions. What had happened was, can you get a little bit more specific about what you did that day or that next 2 years that prevented you from notifying? So that tells you right away, as soon as they open their investigation, they notify them in May, but the official notification doesn't take place until right around that time. They filed the breach report in February 26, 2016 for the 2014. So basically, they're like, hey, look what happened. So word got out somewhere. The bottom line is
they must have just forgot to hit send.
2 years later, stuff hits the fan. So remember, here's one thing to remember. You got a 6-year window here for stuff to hit the fan. So don't think Oh, ain't nothing happened. We're a year behind. No. Don't think you're going to be able to hide it. All it takes is one person to find it and report it, and then your problems are going to get worse.
Yeah. So that brings a question up. Is there a statute of limitations?
6 years.
All right, there you go, folks.
Well, you're required to keep the documentation for 6 years. They may be able to ask you questions about things more than 6 years ago, but you don't have to prove anything that's over 6 years. And now you get to the thing that healthcare is really bad at, purging. Because if you got the documentation and they ask for it, you got to give it to them.
Yeah, nothing's worse than having a data breach of files that you should have got rid of.
I know. So it's certainly something that you may want to consider if you've been diligent in creating your documentation. After it's 6 years old, of course, talk to a lawyer because we don't give legal advice. But the law says you have to have the documentation and you have to have it available for up to 6 years back.
Mm-hmm.
So if you have things that are greater than 7 years, I feel pretty certain you could get rid of them. But you'd have to, as with anything, it depends. So that was never resolved. That was ongoing. I'm sure they were going back and forth. And I can tell you from absolutely dealing with it, everybody thinks that the legal system is just so, a 1 hour TV show. Wrong.
Mm-hmm.
It is so not. And it's just the way it works. You have to give people X amount of time, and then they can ask for extensions. And there's all this stuff that happens. And then sometimes you have to delay because another court needs to complete a case because it's relevant to this one. You never know. So don't expect anything as a serious case in less than 18 months. And that doesn't count the investigation. That would be just hey, we've got a case and we're resolving.
Mm-hmm.
So they've been looking at them all this time and then trying to decide what to do with them. And then guess what happened? Boom.
Not another boom.
They are in the middle of right of boom, hadn't got into the left of boom, and now they have another boom boom. So it's a complicated booming. And this one, they reported this one, March 15th, 2019, that said that on or around January 30th, 2019, the LA Department of Public Social Services reported to the plan, so they must do some of the printing work because the health plan received their health plan member cards were sent out, and it caused in a mailing error. So somebody screwed up. So we got somebody screwed up here. That a mailing error caused people to get the wrong ones. And as I understand it, like one person might get a whole bunch of people's. But there were 1,498 individuals. That's a precise number.
Yeah.
That were notified. So that immediately then, because now I'm in 2016 and I got a data breach over 500, join the crowd.
Mm-hmm.
But it made them automatically go into another investigation. So this has been going on for almost 10 years.
But
since the original breach.
But certainly after the original breach, they had all this help getting their things done and they knew what was going on and they should have just got their stuff together, right? So it would be easy peasy.
One would think before that second boom that had happened. And the answer is pretty clear that they are settling 2 investigations at the same time, $1.3 million, and a 3-year corrective action plan.
I haven't seen one of them in a little bit.
3 years, yeah. We don't see those anymore. It's 2 years. 3 years? No, we just don't see it. So we've got our quote that we have from our director, and it's always going to give you those legal words you should pay attention to. So let's see what our director had to say about this one, David.
All right. So she says breaches of protected health information by a HIPAA regulated entity often reveal systemic noncompliance with the HIPAA rules. All right. So that should tell you right there was systemic noncompliance in this matter.
That was revealed.
Yes, absolutely. HIPAA regulated entities need to be proactive in ensuring their compliance with the HIPAA rules and not wait for OCR to reveal long-standing HIPAA deficiencies. Entities such as LA Care must protect the health information of its insured while providing health care for the most vulnerable residents of Los Angeles County through its coverage, which includes Medicaid, Medicare, and Affordable Care Act health plans.
Ow.
So, what about that language stood out to you, Donna?
Well, there were a few things, as you pointed out. Systemic noncompliance. Seeing that, we've seen that phrase before. And let's be clear, if a lawyer uses the phrase systemic noncompliance, that's not fluff. They don't try to make marketing words. They're making words that say, this is what the law said, and this is what we found.
Mm-hmm.
Yeah. So, systemic noncompliance means it's everywhere. You ain't even getting your, parts of it patty caked together. You're not. They were just shy of saying willful neglect of the obligation to comply.
That's almost as bad as toe up from the flow up.
There you go. And the second thing I noticed was this proactive in ensuring their compliance.
Yeah.
It is on you. And if we find systemic noncompliance, you're not being proactive in your compliance. And the big one, not wait for OCR to reveal long-standing HIPAA deficiencies.
Mm-hmm.
I'll deal with it when somebody makes me do it.
It's like I told you before we started recording. They were probably like, well, we had this incident in 2014. What's the chances of something happening again? I mean, lightning's not going to strike twice, right?
And we do get a boom, boom.
Exactly.
So, I mean, you can't make these assumptions. And I know that there are plenty of people that do, and there are plenty of people that may feel like or may actually skate by without having to actually deal with this stuff. Somebody's going to deal with it, though.
Mm-hmm.
Either the patients, the consumer, your business partners, whoever acquires somebody's going to deal with it. And It ain't pretty when it's done.
No. So in all cases, when we have these, I like to say, pay very close attention to what we're about to say, because for those folks who are always like, well, I'm not sure what HIPAA wants me to do. I don't know what OCR is looking for. This is what these enforcement actions help us do, because we can look at it. And where it says, hey, you didn't do these things, one would think that means you should be doing them.
Well, it was kind of funny because they point out in their bullets of here's our potential violations. And remember, in a settlement, you're not admitting that you violated anything. Mm-hmm. It's kind of like, you're pleading to a lower charge. I'm not making any admissions here. I'm just saying, let's work this out.
Yeah.
That's it.
Can you write the ticket for under 10 miles over the speed limit?
Yeah, exactly. Let's work this out. So their potential violations were, what do you want to think number one was?
I can't imagine, but if I was a betting man, it would probably be the failure to conduct an accurate and thorough risk assessment.
You are correct. Well, they actually said risk analysis in this one.
Oh, yeah.
So failure to conduct an accurate and thorough risk analysis. Shocking.
Yep.
Failure to implement security measures sufficient to reduce risk and vulnerabilities.
Mm-hmm.
How could you do that if you didn't do the first part?
I don't know, but I see so many people do that.
I know.
It's, they jump to step 3.
Yeah.
It's funny. They're doing all this stuff, and I'm like, where's your risk management plan? Oh, we don't have one of those. Well, what about your assessment or analysis? We don't have one of those. Well, how did you get to the point where you're doing the other stuff?
Yeah, you just start in the middle. Yeah.
Yeah.
Start in the middle. We're just gonna put some walls up.
Yep.
We don't need a foundation, nothing at all. Just put some walls up.
Yep. I had this very conversation with somebody the other day. I was like, there's a huge difference between just going out there and saying, all right, let's throw all these protocols and securities in place and let's just do all these things when you haven't yet even looked at where it is that you need the most attention. You haven't done any kind of risk analysis. You don't have a risk management plan. So there's no analysis, no plan. There's just action.
Yeah.
And, it's like, the only time you ever see something where there's a lot of action, but there's no plan, it usually is just things flying everywhere.
Also known as, Wednesday at some people's houses. It's just, there is no plan. There's just action.
Yeah. Just everybody's running around doing stuff. That's what busy looks like, but no productivity is happening.
Very good point. I am busy with my compliance program.
Yeah, it ain't going nowhere, but it's moving fast.
It's not built on anything other than being busy.
Yep.
Yeah, if I can show I'm busy. Okay, so we have the next thing is failure to implement sufficient procedures to regularly review records of information system activity.
Ooh, yeah, that's a tough one.
Mm-hmm. If you ain't looking, trouble's a cooking.
Mm-hmm.
Failure to perform a periodic technical and non-technical evaluation in response to environmental or operational changes affecting the security of EPHI.
We talk about this quite often, where you have something change within your environment and you do a risk assessment or analysis on that change, preferably before you make the change.
Not after.
And then go back and review everything. Make sure it's all done right. So apparently
that means you're putting in a new server, you're swapping ISPs, you're swapping IT companies, you're adding new services, you're adding a whole new department. All of these things, big, moving to a new facility. I'm moving to a new office. I should have a risk analysis.
Yeah.
So.
And we have seen these things go awry. This is not just coming up with stuff.
Yeah.
Even though we can't say who, we've been involved in cases where all those things have not panned out very well.
Yes. And I am glad, I think that whenever our folks, things happen, I'm not like some people who are like, well, if you use our services, you're never going to have a data breach. Anyone tells you that, they're lying.
Run.
Those two they may independently happen, but not a result.
Mm-hmm.
Really it's luck. I don't know. I want to make it the least likely possible, but there's no absolutes in this business. You don't have to worry about HIPAA because you use our stuff. Okay, moving right along. Failure to implement hardware, software, and or procedural mechanisms that record and examine activity and information systems that contain or use PHI. So they didn't put things in place to even watch what was going on. They didn't. If they had, they weren't looking. And they didn't even realize it because they never even asked any questions. So that's what they say the potential violations are. And then they said, wow, we were really bad. And this quote I thought was very interesting. It wasn't part of the necessarily the official director's, quote for the media. But this one is OCR's investigation found evidence of potential noncompliance with the HIPAA privacy security rules across LA Cares organization a serious concern given the size of this covered entity. So we've seen them go into these settlement agreements with smaller ones.
This also speaks to the illusion that, these bigger folks are doing everything right.
Oh yeah, because if they're using somebody, they use so and so for their IT, then and they're big, and I'm like, yeah. I was just talking to the organization today that's starting a whole new. Oh well, we're looking only at people that provide software that is HIPAA compliant. Okay, we're going to need to start with HIPAA compliant is not a thing; it's a point in time. And then they're like, oh yeah. So anyway, so that point of given the size of the organization, we would expect to see more. But on the flip side, the real reason that the difference being, it's not saying we only look at the big ones. It's saying that the big ones go on a 3-year plan and get a $1.3 million settlement.
Mm-hmm.
That size of the covered entity is the length of the corrective action plan as well as the amount of money. It does not change the fact that the enforcement wouldn't have occurred otherwise.
Right.
I think that's important to say. So then they go on a cap for 3. Yes, 3 years, David. That's big. I don't remember the last time we saw a 3-year on something like this.
I guess if a normal one is 2, then if you have some systemic issues as 3.
Yeah, years ago it was 4. So, I guess they're like, we're too busy to keep up with this anymore.
Yeah, with automation is faster now.
So, as one would expect, the corrective action plan tells you you've got to go build a HIPAA security program. These are the things you should do. The good news is you don't have to do it in the same time frame if you just would do these.
Yeah.
Conduct an accurate and thorough risk analysis. Duh. Okay, we can't say that enough, and I don't know why people don't understand. I think so many people think that they've done them, and they don't know what they don't know about what a risk analysis is.
Yeah. A lot of them they just don't do them often enough if they've ever done one.
Oh yeah, I love that.
Yeah.
Oh,
like,
you're looking at doing a
time?
merger? Did you ask for their risk analysis?
Yeah. Yeah. But yeah, I've heard people say, well, yeah, we've done one. It was, 5 years ago or 3 years ago. I'm like,
we did one when HIPAA was implemented. Been around that long, huh?
Yeah. When HIPAA was all small case letters.
It's like there's rust on that gate. Yes, we will go look at the risk analysis. And that's what we should do for our Halloween episode, is an original risk analysis haunted house. I don't know. So, develop the associated risk management plan, develop, implement, and distribute policies and procedures for a risk analysis and a risk management plan. Actually implement that. They shouldn't have to say, but they may have to start saying. And then report to HHS when it conducts an evaluation due to environmental and operational change that affects the security of what is in their possession or control.
Huh. That's interesting.
Mm-hmm. So many people are like, well, we don't have it. Yes, but you control it. So anyway. And then within 30 days, when workforce members fail to comply with the HIPAA rules, they need to report it. That's one that is a zinger, and most people don't get it, that they have to report you if you are not following the HIPAA rules and your organization is under investigation. So, but that one before about the environmental and operational changes, there was a little piece in there that we don't normally see. And or maybe we saw it before, but it wasn't worded as clearly as this is. I don't know. I know that it tells them you need to tell us when you're doing this, right? But maybe they feel that this is remedial.
Yeah.
Or that they're having problems in these corrective action plans, so they're putting it specifically. Either way, this is in there. If during the compliance term, 3 years, LACHP has applied environmental or operational changes materially affecting the security of its PHI. So I'm going to do something with the environment or the way things work. I'm going to do a whole new workflow. I should be paying attention to security. That's another thing to realize is if you're going to change your clinical workflows, you need to do a security risk analysis of what your changes are going to be versus what you're doing today. And that has nothing to do with changing computer systems. It's people. So they shall submit a written report titled Evaluation Report with documentation describing and evidencing to HHS the environmental or operational change and their evaluation of such change that is pursuant to what the law says and consistent with their own policies and procedures. Wink, wink. It should say what the law says. That's significant. And I can tell you there is a lot of discussion that you'll see in a lot of areas pushing HHS and OCR to do more enforcement to get the industry's attention.
Yeah. I do wonder why they didn't go ahead and go with willful neglect.
I know. Well, because willful neglect is a finding in a violation, which may be what precipitated the settlement. So this is potential violations. It does not discuss findings from the potential violations, findings that they are actual violations and a civil money penalty. So could be there.
So systemic noncompliance could be code word.
Yes, that's what I'm
willful
saying.
Neglect. Yeah. I can see that. I can see that. Had this gone the extra mile.
All the warning signs. Whoop, whoop, whoop. Do not pass here.
Man.
So there's a lot of pressure. And I don't know, this could be a message saying, you know what? Heads up. Things are changing. We ain't playing. We're going to start bringing the hammer down. Or it could be a message just to those who have systemic non-compliance, but are not being proactive in assuring their compliance. They're encouraging you to not wait for OCR to reveal long-standing HIPAA deficiencies, or it will not be pretty.
Yeah, and I know quite a few of those.
I know. I mean, if they came in, especially after what they're saying here is, get your ducks in a row.
Yeah.
I mean, they always try to say it, but they're going to have to get more, all the folks that try to do the fear, uncertainty, doubt, the FUD. $1.5 million. Note to self, it's not even $1.5 million anymore with the Inflation Adjustment Act.
That's right.
It's closer to $2 million. And, the 50,000, I think, is up like 70 something million. So
70-something thousand.
yeah, 70-something thousand. Sorry.
It ain't inflated quite into the millions yet.
Not to the millions.
Yeah, right. I know. When I still see people use those numbers, though, I'm like, come on now.
Do you know those numbers? Sometimes people say, well, I know that they're more than that, but they don't say over that. They say up to.
Yeah.
You could say over this amount, but I am always questioning when someone's using those numbers. What do they really know?
Yep. It's
So
like a failed Google search.
and it's not easy to find this stuff either. You
Oh,
got
I
to
know.
dig through the Federal Register to get those inflation adjustments.
Yeah, it is.
It's great reading. So, what would you say would be good advice to any covered entity or business associate today based on this information?
Start now. I mean, you already know the first 3 things you need to do. You got to conduct your accurate and thorough risk analysis, which apparently is a lot more difficult than most people make it to be. So develop your risk management plan, and then start implementing your policies and procedures and conducting all the things about your risk management plan. Put it in action. So there you go. If you just do those first 3 steps.
Yeah, if you actually started doing things, it will happen.
Mm-hmm.
You will get a program. But doing nothing is, the number of people, well, I don't have time to do that. I'm going to do that next year. It's going to be worse then.
Yeah, how are you going to have time to do it when OCR is breathing down your neck?
Yeah, if you think you don't have time to do it now, imagine doing all of that within 120 days, getting all this stuff done and having a timetable and regular reporting back to OCR that requires multiple signatures and attestations.
Mm-hmm.
So for those who think that it doesn't tell me what to do, it's all pretty clear. What the problem is that people don't understand what a true risk analysis is. Because I bet you if in any time prior to today, prior to when they started really getting into this resolution agreement, if you ask it, you could even ask if no one knows this, you could ask somebody who is in the leadership of that organization, how's your HIPAA privacy and security program?
We got it
compliant.
Covered. Yeah.
No, we got this. We're good. No. So, I would wager that somebody somewhere has been given the job of making sure that 1.3 million doesn't explode into something else. Because, as always, now we have 3 years that they have to toe the line, keep in line with this corrective action plan, or all bets are off, and we'll go back to the table and get more money from you in an actual civil money penalty.
Yeah. And if 1.3 million is what I got now, oh gosh.
It ain't going to be pretty.
It's got to be a lot.
So, this is a large organization, yes. So, there's a lot to learn from that. Primarily, don't make that assumption, oh, well, they're big. I'm sure they're doing this.
Yeah. Well, I've heard that before. Like some of these smaller practices will say, well, the hospital system's using XYZ. They've got to be compliant. And I'm like, no, no, they don't. They should be.
No.
Yeah.
In theory, that should be a fair statement. In actuality, not so much.
Yep. Don't assume. All right, folks, that is our show for today. Thanks for listening. Be sure to follow us and share us out on your favorite social media site. And give us a review. We'd love to see some of those come through. Hadn't had one of those in a while. Appreciate that.
Well, if you do one, let us know, because there's so many places now to review. It's impossible for us to keep up.
Yeah, we have stumbled across some before. We're like, oh, where'd this come from?
Because we don't get notified.
Yeah, that's true. All right, folks. Remember, for Donna and myself, that HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.